let's start with PCOS, and I will try to keep the PCOS part short because, like I said, PCOS in itself is a very broader topic that we need to be addressing. So now PCOD, there are two kinds of problems. So basically there are 3 to 4 kinds of PCOS. You can have either one of the PCOS. Now PCOD is basically where again your irregular periods is a symptom, which indicates that there is something wrong hormonally in the body.
Yeah.
One reason of any girl getting PCOS is that any women within first 24 hours of birth, any girl child that's born within first 24 hours of birth, it is decided for that girl child what would be the volume of the ovary and what would be the number of available eggs in the ovary. After that, in your entire lifetime, you do not reproduce eggs. So if you are someone who is born with a heavy ovary, who's born with an ovary volume who's born with an ovary with a volume on the higher side or more number of eggs, any time in your life, it could be menarche, it could be early teenage years, it could be after the delivery of the first child, it could be your late 30s, you can start getting PCO. That's ovarian hormonal PCO. So it is where, because too many eggs are there in the ovary, the amount of hormone which is secreted by so many eggs together, your body is not able to manage it, and it just takes a push for your body to lose the balance completely and for your periods to start getting irregular. Another PCO problem is where there is an autoimmune factor where your body has insulin resistance. So because of this insulin resistance mediated testosterone rise, testosterone is a male hormone which is present in the female body in a regular amount, but because your body is insulin resistant, it increases the amount of testosterone. And once this hormone increases, it throws your period off its cycle. So that is another most common cause of pathology of PCOD that we see. PCOD is also accompanied with another bucket of symptoms where you have 2 kinds of PCOD, lean PCOD and obese PCOD. So if you're a lean PCOD, you might experience these symptoms which I'm talking right now are not related to weight. You could be lean, your BMI is normal, or you could be obese. So you have acne, you have leathery kind of hyperpigmented lines along the folds of your skin, which are indicating indicators of insulin resistance. You can be someone who have always been accustomed of irregular periods, like right from the beginning. It has been irregular. You got your first period when you were 13 years old, and then you didn't get it for 6 months, and then you didn't get it for 3 months. And then right since you were 16 years old, your periods are coming at 2.5 months. Another thing is about the weight, where there is a lean PCO and a obese PCO. So lean PCO is where your body mass index, according to the height, the weight of your body is under control, but it is purely the hormonal part which is causing the irregular periods. Obese PCO is where your body mass index is more on the higher side. So it's a combination. You have a hormonal imbalance in the body, and that there is an add-on hormonal imbalance by the peripheral fat deposition, which is making your body more insulin resistant, which is like a vicious circle. Vicious cycle. So PCOD is mainly these hormonal problems which do not let your ovaries develop an egg, rupture an egg, and get your periods at the end of 30 days. So the hormone shift, first 15 days is estrogen hormone, last 15 days is progesterone hormone. Once the egg ruptures, the hormone shift occurs. In PCOD, this hormone shift is not happening because of various reasons we just discussed. So if you are someone who has PCO, first and foremost, it requires diagnosis. Diagnosis has to be blood investigation regarding your hormone levels, your DHEA, DHEAS, testosterone levels, your fasting serum insulin levels, blood sugar levels. Second important investigation is ultrasound, where the ovarian volume should be evaluated so that we know whether we are dealing with heavy ovaries, or is it that your ovarian volume is normal but it's the insulin resistant type of PCO that we are dealing with. Because once you make a diagnosis, you have to treat the cause. Treating only irregular periods is not going to treat your PCOD. Like I said, irregular periods is a symptom. And then also, no matter how much you try, PCOD is all about lifestyle modification, proper diet, and a healthy lifestyle pattern where you are sleeping for 6 to 8 hours, you are working well, you also have time to do physical exercise of around 30 to 40 minutes in your entire 24 hours. So PCOD, I would like to conclude here, because the more depth we go into, this whole lecture will become about PCOD. Coming to the second one, the second most common cause, thyroid disorders. In thyroid disorders, the most common thyroid disorders means your thyroid could be too much or your thyroid could be too less. If it's too much, it's hyperthyroidism. If it's too less, it's hypothyroidism. Out of these two, the most commonly what we see is hypothyroidism, where your thyroid is underactive. It is not secreting enough hormone for your body to work with. So there are many other symptoms along with hypothyroidism. You are groggy most of the time of the day. You are sleepy. You don't feel motivated to do any physical activity or scheduled work for that matter, which is very different from your previous self. So previously you were a very active person, you were a morning person, you were a very enthusiastic person, but now suddenly your energy levels have gone down and you are someone who's not even able to get out of bed. You're irritated and if others in the room are not feeling cold, but you are the one who feels cold. Others in the room are not feeling that hot, but you feel disproportionately hot. So these few signs and symptoms. Then there is thinning of hair, brittle hair, a lot of hair loss, swelling on the face, swelling under the eyes, swelling of the hands and feet when you get up early in the morning. All these set of symptoms, along with recent history of irregular periods.
Yeah.
Recent history is past 6 months. So what all the other symptoms that I talked about right now are hypothyroidism. In hyperthyroidism, it's a little different. You don't feel hungry. You are losing weight out of proportion of your physical activity. Your eyes starts to bulge out. It looks like your eyes are bulging out of the socket. And also you feel very hot most of the times. So these are the symptoms where again you should test your thyroid, and if the thyroid is on the higher side, we need to treat the cause. Another thing about hypothyroidism is there is something known as Hashimoto's hypothyroidism. It is an autoimmune thyroidism. Auto means your own body's immunity. So autoimmune is something where your own body cannot differentiate between the good parts of your body and the bad parts, and it attacks the good parts also. So your body produces these attackers which are attacking your thyroid hormone, which is actually a normal part of your body. So in Hashimoto's thyroiditis, what happens is it starts with mild hypothyroidism in the beginning, but because your thyroid hormone is being attacked by your body, the functional potential of the thyroid hormone reduces very rapidly. And then also you have irregular periods. So in these cases, you will have to take thyroid tablets lifelong. And then the thyroid tablets ka power will also keep on increasing if you are somebody who's having Hashimoto's thyroiditis. And also thyroid hormone is the secondary hormone. The primary hormone is secreted from the brain. So thyrotropin releasing hormone and prolactin secreting centers sit side by side. So if you have a thyroid problem which is going to break the regularity of your thyrotropin releasing hormone, the same pattern is going to break your prolactin hormone also. So most of the times what people do, they get tested, they do a thyroid evaluation, but they don't do the prolactin evaluation. And then they are taking the thyroid tablets. They are taking 3 to 4 months of hormonal tablets to regularize their period, giving thyroid tablets a chance to bring the thyroid levels in range. And when they stop the thyroid tablets and the hormonal tablets to regularize menses, the periods are irregular again. And that is when you go and check for the prolactin. It is actually the prolactin that is high, which is making your thyroid high. So if your prolactin is high to begin with, we first treat the prolactin. Because there is a 90% chance that if the prolactin comes down, the thyroid will come down on its own. And there'll be a balance. And only thing you had to do was take 4 to 5 tablets in a month. That was it. And you are done. There are 10% of women, though, Dr. Renu, that have constantly raised prolactin level. We don't know the reason. It is not life-threatening. It doesn't cause any other problems. But the prolactin levels are always in the range of lower limit of normal, say 40 to 100. So such women then have to take prolactin tablets weekly, lifelong.
Yeah.
And this kind of prolactin increase prolactin increase between 40 to 100 and always at a high level is associated with Hashimoto's thyroiditis, again because it has an autoimmune pathology. So this is about the thyroid, and also I spoke a bit about prolactin. Now coming to the third reason, which was residual cyst. So for the residual cyst, if it's a residual cyst, if you do get your periods, there's a very good chance, a good 50% chance that it will just dissolve with the period and it will go away, and your other periods for the next period and the period after that will just be regular. If the cyst does not dissolve on its own, we don't have any other option but to prescribe oral contraceptive pills. If we can stop your ovulation, that's the only way the hormones that are feeding the cyst to exist will come down to the baseline and the cyst will collapse on its own. So if it's a simple cyst, we observe for 1 month. After a month, we do an ultrasound evaluation. If the cyst is still sitting there, we give the tablets for 3 to 6 months and the cyst is dissolved, the problem goes away. Cortisol levels, of course, you need a proper endocrinologist's opinion. You need evaluation in depth. What is the reason of high cortisol level? Is it your adrenals? Is it coming from the hypothalamus? Then it's a whole different entity of treatment and a whole different specialization altogether.
Right.